Hello, students. So, today we are going to see a new topic, which is also a neurodegenerative disease known as dementia, which is the main sign for Alzheimer's disease, and it is neuroprogressive degenerative disorder. So, we'll be seeing first of all what are the changes in the brain because of dementia, because of aging, and how dementia is a disease characterized from Alzheimer's disease. So, first thing, what are the normal changes in the mental ability with aging, which are normal for an individual? So, first things, language. Slower getting words from the brain late in life. Yes, after 65 to 70 years, these changes happen. There are fewer, the vocabulary decreases for that individual. Intelligence decreases, little slower solving problems. So you can say cognition decreases. Memory decline in processing of information starts at about age of 40. 70 years olds take up to 4 times longer in basic memory tests than 20 years old. So you can see the difference. 4 times more time is required for an individual to recollect something if their age is 70 compared to an individual at the age of 20 years. Reaction time. Yes, we have seen this example. I've already given you the example. When you're taking a reverse, yes, you already heard you have bumped the other car, but the reaction time is so slow. You are moving more and more, and by the time you go for braking, it is already the damage has already been done. Yes, so it is slow. With time, reaction time gets slower. So, what is dementia? So, dementia is a collection of symptoms resulting from disease or injury to the brain. It is not just related to one memory function, it is also related to other cognition parts. We'll be seeing that. Uh, Dementia, as we discussed, it is a progressive. That means it typically gets worse over time. It is a neurodegenerative disorder. So, what happens in the brain? So, there are billions of cells called neurons. You are already aware in the normal human brain. Neurons are able to pass information from every part of the body to neurons in the spinal cord and brain. Information is also passed through them. Billions of neurons in the brain. This allows us to think, feel, act. Yes, and the connection between two neurons is known as synapse. Those are the most important aspect you should remember. In conditions that cause dementia, the neurons and the channel of passing information between the neurons are damaged. Some synapses close, some neurons are damaged with age. The person can no longer think and act as they did before because of death of such neurons, closing of such synapses. So this is a demographic. You can see at the age of 65 to 74, there are only 3% people with dementia. As the age progresses to 75 to 84, the number rises to 19, and around 50% or 47% to be exact, at the age of 85 have dementia. Yes, so half the population goes for these symptoms, dementia. So there are 5 A's of dementia: amnesia, aphasia, apraxia, agnosia, and agitation. We have seen all of them. We are going to see them again. So first is amnesia, that is memory. Recent memory is the most difficult for people with dementia, cannot store information, cannot retrieve stored information, and information received and retained for minutes, hours, or days. So the first thing or the most affected is recent memory, immediate recall. Like when a patient is coming to you, you tell him your name, and at the same time, after 1 or 2 minutes, you ask what was your name. That will be the most difficult part for a dementia patient to recollect. Long-term memory store information from months or years ago. These are often the only memories individual with dementia can remember. So long-term memories like birth dates, like anniversary dates, that children's spouse your birth date, and everything they'll remember precisely. They are least affected. Second is aphasia, cannot understand the speech, will not be able to respond appropriately because they do not understand what you are saying. Yes, the processing power, the cognitive power decreases, so they cannot understand if you are going too fast. Cannot produce speech also, their vocabulary is jumbled and difficulty finding proper words. Apraxia cannot perform tasks that they have done throughout their life: cooking, operating appliances, dressing, bathing, eating. They get confused when you tell them to start brush or to start walking or take that thing from a place and put it at another place. These all commands are confusing for them. Why? Because they no longer have the capacity to do that. The brain does not understand the commands, or they do not understand how to perform that. That is apraxia. What is agnosia? Perceptual disorder, inability to correctly recognize the images, people, animal, objects, also the smell to identify ability to identify the smells and touch are also lost. Say they misjudge a person, they misjudge what object is placed, you show them a pen, they see as a stick or anything else. Yes, even name of the individuals they cannot correctly find or remember and cannot appropriately recollect. Next, agitation. Agitation is commonly in dementia and more likely if they have discomfort, like if the person is thirsty, needs to urinate, or it is too hot or too cold environment. Environment too stimulates it, like for noise and too many people or a crowded place that will form agitation. Agitation is a kind of a mood. So dementia has several causes, the most important being Alzheimer's disease, forming around 50 to 70% of it. Said other things are vascular dementia, mainly because of stroke, frontotemporal dementia, and dementia with Lewy bodies. So, first, Alzheimer's disease, the most common cause of dementia. This is the normal brain transverse section, and if you can see, this is Alzheimer's brain with plaques and tangles in it. Also, you can represent it. This is a healthy brain and this is advanced Alzheimer's. You see the sulcus, the gyri, and everything decreases. Overall mass of the brain itself decreases in Alzheimer's disease. So increasing forgetfulness about recent activities or events is the first warning sign of Alzheimer's disease. They forget to take the medication. They forget what they'd eaten for breakfast. They forget where things were placed by them. Forget information you just gave, like immediate recall, as we discussed, your name to the patient and recollecting, asking them to talk or tell you the name after 1 or 2 minutes. They will not be able to. That is sign of Alzheimer's disease. Changes in how people act and behave. It is not just forgetfulness. Again, I'll be reminding you. It also depends on how the cognition works, how your behavior works, how you are able to perform tasks. Everything will be part of dementia and Alzheimer's disease as a whole. So can't follow conversation. In middle of the conversation, they'll start talking about something else. So that is a sign of Alzheimer's disease, early sign. Response inappropriately or in a way that is very different from their past behavior patterns. Decrease ability to perform tasks requiring reasoning and higher level mental skills. Follow a count correct change. Forget how to drive to familiar places. So first thing, respond inappropriately or in a way that is very different from their past behavior patterns. If the patient is coming to you already and you are in contact with that patient, then only you'll be able to say, yes, this is positive. Otherwise, only the relatives or their spouse or the caretakers will be able to point it out, like their behavior has changed from last 6 months or 1 year. It will not be in a day or two. Yes, unless and until it is because of stroke. Also decrease ability to perform higher reasoning, and because of that cognition will be altered. We have already discussed that. Later stages, these were the early signs. Now in later stages, what all changes will happen? Have increasingly great difficulty with memory, eventually will not know their loved ones or themselves, so completely forgetting everyone in their surrounding, will not remember simple directions even in home, become unable to perform daily tasks like bathing, dressing, eating. All things become difficult. How they do not know how to perform. Later stages of Alzheimer's disease become unable to communicate through language, display more behavioral changes like agitation, wandering, continuous repeat verbal and or physical behaviors, eventually be unable to walk or care for self in any way. Vascular dementia, acquired mental changes from damage due to disease of the vessels in the brain. Stroke is the most common cause of damage we already discussed. Damage may happen in step by step progression over time, changes caused by many small strokes over time. Language and communication problems are foremost in vascular dementia because of stroke. Can't speak or use wrong words, can't understand what others say. So, comprehension is also affected. Talk using words that are not understandable, gibberish. So there are many parts where it can happen, many regions where it can happen. The most important region is the language region, Broca's and Wernicke's area, and the global aphasia. As you already are aware, we have seen that in stroke. And next is frontotemporal dementia. Frontal and temporal region responsible for intelligence, judgment, behavior will be affected. So early behavior and or language changes will include talking in a jumbled fashion that is difficulty or impossible to understand. Cursing, becomes angry very easily, so that is agitation again. May behave in ways out of character with his or her past history. So, the types of dementia discussed in this presentation are the result of insult to the brain that lead to damage and destruction of parts of the brain, controlling memory, judgment, reasoning, eventually bodily control. All the ADLs, activities of daily living, will be affected. These are all progressive in nature. We discussed this, and they are not reversible at this time. There is no cure for Alzheimer's disease. Like we have seen in Parkinson's disease, there is no simple cure for such diseases. Once it starts, it will progress. There is only symptomatic relief that you can give. So, what will be the physiotherapy treatment? We'll be seeing in brief. We cannot help the patient, such patient, in detail anywhere. But yes, we can help them symptomatically, at least in ADLs, and what all things we can stop, we can. So, in next lecture, probably when you'll be seeing the next day, we'll be having lectures. So, we'll be discussing in live sessions what role a physical therapist can play in reducing such symptoms of dementia of Alzheimer's patient. And this is it about the lecture. Hope you re-listen to it again. And once you have, an assignment will be given after the lecture online session on the Zoom. Yes, so thank you. Have a good day. Be safe.